Hello dear friends, today we talk about diabetes insipidus and symptoms, causes, diagnosis, tests, management, treatment, prevention, homework. What is diabetes insipidus? Diabetes insipidus is a rare but treatable condition in which the body produces too much urine, pee, and isn't able to properly retain water. Diabetes insipidus can be chronic, lifelong, or temporary and mild or severe depending on cause. Diabetes insipidus is mostly caused by an issue with a hormone called antidiuretic hormone, ADH, or vasopressin. The body doesn't make enough of ADH or the kidneys don't use it properly. People with diabetes insipidus pee large volumes of urine several times a day and drink large amounts of water because feel constantly thirsty. If you have diabetes insipidus and don't drink enough fluid to replace water lost through urine, you can become dehydrated, which is dangerous to the health. What are types of diabetes insipidus? 4 types of diabetes insipidus, including central diabetes insipidus. This is most common type of diabetes insipidus. It happens when the body doesn't have enough antidiuretic hormone, ADH, or vasopressin. The hypothalamus produces ADH, but the pituitary gland stores and releases it. You can get central diabetes insipidus if the pituitary gland or hypothalamus is damaged. Nephrogenic diabetes insipidus. This type of diabetes insipidus happens when the pituitary gland releases enough ADH, but the kidneys don't respond to it properly and can't retain water. Dipsogenic diabetes insipidus. In this type of diabetes insipidus, an issue with the hypothalamus unrelated to ADH production causes you to feel thirsty and drink more liquids. Because of this, you may need to pee often. Gestational diabetes insipidus. This is a rare, temporary condition that can develop during pregnancy. Gestational diabetes insipidus occurs when the placenta, a temporary organ that provides nourishment to the baby, makes too much of an enzyme that breaks down the ADH. People who are pregnant with more than one baby are more likely to develop condition because Y have more placental tissue. Gestational diabetes insipidus usually goes away shortly after pregnancy is over. It's not to be confused with gestational diabetes, which is a type of diabetes mellitus that can develop during pregnancy in people who don't already have diabetes mellitus. Gestational diabetes mellitus causes high blood sugar. Symptoms. Main symptoms of diabetes insipidus include needing to pee often, including through night. Passing large amounts of light-colored or clear urine each time you pee. Feeling very thirsty and drinking liquids very often. While most people produce 1 to 3 quarts of urine a day, people with diabetes insipidus can produce up to 20 quarts of urine a day. If diabetes insipidus isn't treated or if a person with diabetes insipidus stops drinking fluids, it can quickly lead to dehydration. Symptoms of dehydration include feeling dizzy or ligated, feeling tired, having a dry mouth, lips, and eyes, difficulty performing simple mental tasks, nausea, fainting. Causes of diabetes insipidus. Causes of central diabetes insipidus. Damage to the hypothalamus or the pituitary gland from surgery. Damage to the hypothalamus or pituitary gland from a head injury, particularly basal skull fractures. Inflammation, granulomas, from sarcoidosis or tuberculosis. Tumors that affect the hypothalamus or pituitary gland. An autoimmune reaction that causes the immune system to damage healthy cells that make an antidiuretic hormone, ADH. An inherited gene mutation on chromosome 20. Causes of nephrogenic diabetes insipidus. Certain medications, such as lithium and tetracycline. Low levels of potassium in the blood, hypokalemia. High levels of calcium in the blood, hypercalcemia. A blocked urinary tract. An inherited gene mutation. Chronic kidney disease. This is a rare cause. Causes of dipsogenic diabetes insipidus. Damage to the hypothalamus from surgery, infection, inflammation, a tumor, or a head injury. Certain mental health conditions, including schizophrenia and obsessive-compulsive disorder. Causes of gestational diabetes insipidus. Gestational diabetes insipidus is a rare condition that affects people who are pregnant. It happens when the placenta makes too much of a certain enzyme that breaks down the antidiuretic hormone, ADH, or vasopressin. Diagnosis. The healthcare provider may order several tests if you're experiencing SE symptoms. A diagnosis of diabetes insipidus also involves determining type and cause of it. Tests. Blood test to check antidiuretic hormone, ADH, or vasopressin, levels. Blood test to check glucose levels to rule out diabetes mellitus. Urinalysis to check osmolality, concentration of the urine, and/or to check for ketones, which could indicate diabetes mellitus. Imaging tests, such as an MRI, to see if issues with the pituitary gland or hypothalamus are causing the diabetes insipidus. Treatment. Treatment for central diabetes insipidus and gestational diabetes insipidus. Desmopressin is first-line treatment for central diabetes insipidus. It's a medication that works like an antidiuretic hormone, ADH, or vasopressin. You can take desmopressin as an injection, shot, a pill, or in a nasal spray. Healthcare providers also sometimes use desmopressin to treat gestational diabetes insipidus. Treatment for nephrogenic diabetes insipidus. Treat it with medications called thiazide diuretics, which reduce amount of urine the kidneys produce. The provider may also suggest taking nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, to help for reduce urine volume. Treatment for dipsogenic diabetes insipidus. Researchers haven't yet found an effective way to treat dipsogenic diabetes insipidus. What are side effects of desmopressin? Possible side effects can include headache, abdominal pain, nausea, a blocked or runny nose, nosebleeds. If you take too much desmopressin or drink too much fluid while taking it, symptoms: headaches, dizziness, feeling bloated. What can I do to manage my diabetes insipidus? If you have diabetes insipidus, aside from medical treatment, it's important to drink water regularly to make sure you don't get dehydrated. If you have a mild case of nephrogenic diabetes insipidus, the healthcare provider may recommend reducing amount of salt and protein in the diet, which will help the kidneys produce less urine. It's important to always talk to the provider before drastically changing the diet. If you have diabetes insipidus, it's also important to see the provider regularly to make sure the treatment is working and that you have right dosage of medication. Prevention. Risk factors for developing diabetes insipidus. Have a family history of diabetes insipidus. Had brain surgery or a major head injury. Take medications that can cause kidney problems. Have certain metabolic disorders, such as high blood calcium levels or low blood potassium levels. If you're pregnant, you're at a higher risk of developing gestational diabetes insipidus if you are pregnant with more than one baby. Have a condition that affects liver function, such as preeclampsia and HELLP syndrome. Homework. If you know, write in the comment box. What is difference between diabetes insipidus and diabetes mellitus?